What is proctitis? Proctitis is the inflammation of the rectal lining, rectal mucosa, leading to discomfort, pain, and bowel issues. It can be acute short-term or chronic long-term and is often associated with infections, autoimmune diseases, or radiation therapy. Causes of proctitis. 1. Infections, sexually transmitted infections, STIs, gonorrhea, chlamydia, syphilis, herpes, and HIV, bacterial infections, salmonella, shigella, campylobacter, or Clostridium difficile. Viral infections, cytomegalovirus CMV, especially in immunocompromised individuals. Parasitic infections, Entamoeba histolytica amoebiasis. 2. Inflammatory bowel disease IBD, ulcerative colitis UC, affects the rectum and colon, causing persistent inflammation. Crohn's disease can cause patchy inflammation anywhere in the digestive tract, including the rectum. 3. Radiation therapy. Radiation proctitis occurs after radiation treatment for cancers of the prostate, cervix, rectum, or bladder. 4. Autoimmune conditions, celiac disease or other immune-related disorders that trigger inflammation. 5. Chemical irritants, enemas, laxatives, or rectal suppositories can cause irritation or an allergic reaction. Symptoms of proctitis, rectal pain or discomfort, may worsen during bowel movements. Frequent urge to defecate, tenesmus with little stool output. Diarrhea or mucus discharge from the rectum. Rectal bleeding, blood in stool or on toilet paper. Pain during intercourse, if caused by STIs. Fever and fatigue, if infection-related. Diagnosis of proctitis. Doctors diagnose proctitis through 1. Medical history and physical exam, asking about symptoms, sexual history, and underlying conditions. 2. Sigmoidoscopy or colonoscopy, a flexible tube with a camera is inserted into the rectum to examine inflammation. 3. Stool tests detect infections like bacteria, viruses, or parasites. 4. Blood tests check for inflammatory markers and infections. 5. Biopsy, tissue samples may be taken for further examination. 6. STD testing, if a sexually transmitted infection is suspected. Treatment of proctitis. 1. Medications, antibiotics if bacterial infections are present, ciprofloxacin, metronidazole. Antiviral medications for viral infections like herpes, acyclovir, valacyclovir. Anti-inflammatory drugs for IBD-related proctitis, mesalamine, corticosteroids. Immunosuppressants for autoimmune-related proctitis, azathioprine, biologic therapy, infliximab, adalimumab. 2. Lifestyle and home remedies, increase fiber intake to ease bowel movements. Stay hydrated to prevent dehydration from diarrhea. Avoid spicy or acidic foods that can irritate the rectum. Use sitz baths to relieve rectal discomfort. 3. Medical procedures, surgery for severe cases of IBD-related proctitis. If medication fails, removing part of the rectum may be necessary. Hyperbaric oxygen therapy for radiation proctitis helps heal damaged tissue. Complications of proctitis, chronic rectal bleeding leading to anemia. Rectal ulcers and scarring, fistulas, abnormal connections between organs, increased risk of colorectal cancer in long-term cases. Prevention of proctitis, practice safe sex to avoid STIs. Maintain good hygiene and avoid sharing contaminated items. Manage IBD properly with regular medication and diet. Limit radiation exposure when possible. Conclusion: proctitis is a painful and uncomfortable condition that can arise from infections, autoimmune diseases, or radiation exposure. Early diagnosis and proper treatment can prevent complications. Managing underlying conditions and lifestyle modifications are key to preventing flare-ups. Thank you for watching my video. Please subscribe my channel.